Dr. Amol Soin has invented a new way to treat pain using a new type of medical device called a spinal cord stimulator. He's also developed a nerve stimulator that treats constipation in patients who have spinal cord injury and another one to treat urinary incontinence. Dr. Amol joins us live now. Thanks for joining us.
Hello. Thank you for having me.
Thank you for being here. Look, firstly, I guess this sounds quite remarkable. Tell us about your new spinal cord stimulator and how it helps treat pain.
Well, we've developed a new type of nerve stimulator and a way to treat pain. And the way that works, that sends electrical impulses directly to the spinal cord to try to turn the nerves off from firing pain signals. And we found it to be very effective in treating pain. But we also realized we can treat a lot of things like constipation, urinary incontinence, anything where the nerve is involved somehow in the process.
Yeah, I mean, it's such a interesting one in that there's obviously we know the spine is obviously the key to everything. How long has all this research taken you? Tell us a little bit about the process, how long you've been on this journey.
Well, I have my own research lab in Dayton, Ohio. And we have been working on this for a number of years. And spinal cord stimulation has actually been around for quite some time. But what we have is a unique interface and a unique algorithm, one that communicates with the nerve more like the way nerve cells communicate with each other. And by speaking the same language, we can get phenomenal results. But in addition to this type of thing, nerve stimulation, we also in our lab have worked on a number of new medications to treat pain, particularly ones that are non-addicting, because America, as you know, is crippled with an opioid crisis.
Yeah, I mean, tell us more about this, because obviously this has been a serious concern and this has made global headlines. We've even heard about this obviously here in Australia in regards to the addictive qualities of some of these really hardcore pain medications. So how have you gone about avoiding that with your drugs?
Well, so everything that I do is trying to find ways to treat pain without addiction, without opioids. And as a result, I've spent some time trying to study how nerves communicate with each other. And that's how we came up with the spinal cord stimulator. But I also realized that there are chemical compounds that can get nerves to stop firing pain signals. And we've developed two drugs. One that's really exciting right now is a low-dose naltrexone compound that's able to treat pain without addiction.
So what's the pathway to market in regards to getting approvals from the medical authorities, and how long does that process take for you?
Well, you know, in the U.S., it does take a number of years. We have to go through clinical trials. And currently, we're in clinical trials with our spinal cord stimulator and our other nerve stimulators that you mentioned for incontinence, constipation. We probably have to do maybe 2 more studies for those, and then they'll be good to go. The drug is further along. I think we're on our last study coming up here. So hopefully, within the next couple of years, those should be available on the market here.
Well, congratulations to you. Certainly sounds like amazing science and medicine that the world definitely needs. Thanks for joining us on the program.
Thank you.